Hi everyone, this is Wahida Kazi, and today the subject that I'm going to discuss is social distancing or physical distancing. The term is so popular nowadays because of the COVID-19 pandemic, but I know all of us, we understand the term social distancing, but still, there is nothing wrong to recap or review the this important matter. So I thought, why don't I just make a video and some of you might be benefited from my discussion topic channel, although I haven't decided the name yet, that I'm gonna review some of the very important terms one by one so that the layperson can understand better, because sometimes we who work with the healthcare organization, we read required document to get the clarification, and also we get the experience directly from the field. But for other individuals who are not exactly related to the health field, sometimes they might face difficulties understanding very general terms, and they might interpret differently. So sometimes it is always good to recap or review the terms that we usually see in the media, through the organizational publications, and also in our day-to-day conversation. One of such term now during the COVID-19 outbreak is social distancing or physical distancing. So if I have to define social distancing, I'm going to tell that social distancing or physical distancing means to maintain 6 feet or 2-meter distance from others who are not part of our household. So now your household means the people whom you are living with. For example, your family members with whom you live in the same dwellings. But if it is a tenant and they have a separate washroom and separate entrance, that different, then you possibly will be able to maintain the social distancing, although you might have the living arrangement that is very close to each other. So this 6 feet distance is about 2 arm length. So when you span your arm, and that is the 2-meter distance. But it can vary people to people, because some people are taller, some people are very short. So it's always good to check like your arm length, how long that is. This is a almost 5 feet the measuring tape, and if I hold this tape like I span my hand, and it is almost a little bit more than the 5 feet. Important to acknowledge, if some individual in your family or in your group cannot wear masks or tolerate masks because they are infant, elderly, or have other medical condition, then you are the person who's supposed to maintain social distancing as well as wear masks. So it is in feet, it is 6 feet, and 2 meter, or the in meter unit, it is 2 meter. So why social distancing is a primary prevention, it's important to understand. So many respiratory viruses, they actually grow and multiply in our respiratory system, In our respiratory system is the nose, and then our trachea, our before that our larynx and pharynx, and then trachea, and then trachea will divide into bronchus, and then the branches of bronchus, bronchi, and then you will have your two lung. So any respiratory virus, they actually live in your nasal tract or respiratory system. So when somebody sneeze, cough, or even like talk, because there is connection inside with your nose and mouth through the oropharynx or laryngopharynx. So the pharynx, larynx, these are the same pathway inside. So when you cough, sneeze, or talk, the virus will shade, or virus will come through your mouth in the form of a droplet. Okay, so this droplet, when somebody sneeze or cough, it can pass at best like the length of 2-meter distance. So it is very important for you to keep that distance even from the healthy person, in case that person is incubating the virus and then shade the virus in their sneeze or when they talk loudly. And another reason, you are maintaining a circle of 2-meter distance around you with others. So somebody, if they are infectious unknowingly and they are not still showing any symptoms, but they can shade the virus, so you're not actually immediately in contact with them in their immediate surrounding. But social distancing is alone is effective, but it's will be more effective when you wear your mask. It could be a non-medical cloth mask or a surgical mask. It depends on what activities you are doing. If you are a non-healthcare worker and in a social setting, you can wear a non-medical mask to cover your nose and mouth. That will help you in two ways. You are not going to touch your mouth or nose, and also you are not going to shade the germs and through your sneeze or cough. But still, because it is a non-medical cloth mask, you are not 100% protected from others who are sneezing or coughing and infectious. But when you do both social distancing as well as wearing a mask, that will help much better. That two things synergistically help you. So sometimes we feel like, so before I discuss the importance of social distancing, there are certain respiratory etiquette that need to be maintained too. Number one is not touch your mouth and nose without reason. If it is really itchy and you have to touch it, then make sure you do the hand hygiene after that. When you cough or sneeze, even if you don't have a mask, please try to do that in your sneeze on your sleep, or in case it is in your hand, it is not always good. Wash your hand when there is a sink. If you don't have water or sink, just keep your hand sanitizer with you so that you can immediately do your hand hygiene. So another important thing to mention is that does it mean that you will be withdrawn from all kind of social activity? That is not the truth. Some people think so. Okay, but the social distancing actually help you to engage in others or in a social activity, but in a safer way, so that you can protect yourself, and you are protecting yourself so that you don't come immediate contact with somebody's surrounding environment, right? So what is the benefit of social distancing? By maintaining social distancing, we can protect ourselves. You are being a good example to others, because people actually follow others, right? When majority of the people in the society following the social distancing rule, then a little number who doesn't follow, they will actually will follow. Okay, in some society there is a legal piece that enforcement, they try to do enforcement. We are protecting ourselves also from being a carrier or vehicle for the germs that we don't know, and we can take it to our loved one. If we become infectious with COVID-19, even if we don't become seriously ill, we will continue shade this virus during the period of infectivity. So the period of infectivity is 2 days before onset of illness of a case or infectious individual, and 14 days from the day of onset of their illness. If So we discussed about benefits, but what are the challenges? One of the main challenges is social isolation, and this is actually true for people who are elderly and individuals who are having disabilities or comorbidities, who need to depend on others for activity of daily living, right? So to prevent that, we can actually contact them on a increased frequency over phone or through the Skyping, or at least knock at the door just to say like how they are doing and see like whether they need any kind of assistance or not. And also for the young people, one of the challenges, they are not having much fun with their friends because they need to avoid lots of different kind of social activities, especially the group activities like partying, barbecuing with a big group. But to avoid this kind of mental distress, we can definitely choose great activities. Some of these activities are indoor activities, and some of those are outdoor activities. So indoor activities such as reading book, gardening, indoor plant, or cooking, cleaning house, listening radios, drawing, watching TV. These are the great activities that we can choose. These activities required focus, and we can remain calm and increase our knowledge. For example, if you wanted to like read some book or watch movies that you never able to done because of the too much workload or business, you can try those and keep yourself engaged. Some outdoor activities are activities, for example, meditation, bicycling, hiking, connecting with nature, going out far from city, fishing. But you have to choose the location where there are not too much crowd. Even if you visit a park, just make sure when you cannot, the part of the area where you cannot avoid a crowd, you are going to wear masks, and when you are a little bit distance from other, then you can take off your masks and enjoy your activity.